My name is Nomin. I'm a nutrition officer working in FAO regional office. My presentation would be focusing on recently FAO published a publication. It's called Milk and Dairy Products in Human Nutrition, and you may already saw the publication has been displayed outside. This has been based on extensive scientific review and a lot of review of the papers been submitted by the experts. So before going to the why we are talk on human nutrition and milk and dairy products, I would like to just highlight key nutrition situation, key nutrition information. So there were significant progress has been made in reducing undernourishment in last 20 years. There's still in the world around 842 million people are undernourished. This is according to the latest FAO estimates, the state of food insecurity in the world 2013. At the same time, we have also around almost 2 billion people who are deficient in essential vitamins and minerals. And it is also estimated that in child under age of 5, 1 in 4 is stunted, which is approximately 10 to 25% of all child in the world. And it's estimated 162 million under age of 5 are stunted. But at the same time, we're talking about not only undernourishment, we have facing also the increasing double burden of malnutrition, particularly people getting overweight and obesity. Around 1.4 billion people are overweight, and out of which 500 million are obese. This is according to WHO estimate 2013. So FAO is, of course, livestock is very important, and particularly dairy and milk products. FAO's vision on nutrition in particular is the world free of hunger and malnutrition, where food and agriculture contributes to improving the diets, but not only the diets, also living standards, and especially focusing on the poorest and most vulnerable in an economically, socially, and environmentally sustainable way. So why milk and dairy product is important in human nutrition? Because globally, many billions of people consume milk and dairy products every day in our life. Consumers, industry, and governments, they need to have an up-to-date information on how milk can contribute to human nutrition. And so, as I explained at the beginning, that in pushing this mission, FAO undertook an extensive work which took several years, and as a result, we have publication which is called Milk and Dairy Products in Human Nutrition. The book evaluates current scientific knowledge, but not only. It's also look at the global perspectives. It provides also key options for governments, but not only for the governments, also for the private sectors and other stakeholders. So we say that why we have to drink milk. Milk is not only important source of energy, but it also contains macro and micronutrients. It provides approximately 3% of the dietary energy supply, not only in Africa, but also in Asia. And it's also a very high nutrient in it's high quality protein source. It contains also carbohydrates and fat. And also it contains micronutrients, calcium, magnesium, different vitamins, and so on. So what are the health benefits of including the dairy in the diet? It's because it benefits both healthy and nutritionally vulnerable people. And it's also nutrient-dense food that supply energy and significant amount of quality protein to the diet. Significantly also contribute to meeting the body's needs for calcium, magnesium, vitamin B12, and it's also associated with increased linear growth, and it's important, of course, for the bone and oral health. So what is the role that milk plays in addressing malnutrition? We were saying that, okay, milk contains different macro and micronutrients. It's a good source of protein. It's a good source of carbohydrates. Also, it can supply components that are particularly important for the child growth. Because we now, if you may already aware or heard about this scaling up nutrition movement, many countries are joining this movement because many countries still are facing a high rate of stunting among children, and particularly a focus now being shifted to 1,000 day of a window of opportunity when the child is actually conceived and up to 2 years old. So milk especially important in the diets of infants and young children. With a very low fat intake, the availability of other animal source food is may limited in rural areas in particular. So skimmed milk is not recommended, of course, as a major food source during the first year of life. But it also can prevent stunting because, as a previous slide, we were saying that stunting is so high in many countries, in many Asian countries. The Asia region is home to almost 62% of undernourished people, and some of the countries have more than 30% of the kids are stunted. So the milk can also contribute and play an important role. And milk-based products have also been successfully used in the treatment of moderate and severe malnutrition in children. So that can also prevent the death of the young kids. However, we say that, okay, milk is good. We understand milk products also contain essential nutrients, but then there are also, we should consider some health risks. So the link between dairy consumption and non-communicable disease is inconclusive. Then many countries or many people claim that drinking milk they're lactose intolerant, which can cause significant discomfort and also decrease quality of life in some people. And also, it's claimed that some people are affected to allergy to cow milk protein, particularly occurring primarily in infancy and childhood. And cow and other animal milk consumption is not recommended for infants less than 1 year old. Of course, comes when we talk about exclusive breastfeeding. We are not encourage the mothers to promote cow milk, of course, rather than human milk. What is lactose intolerance? Many people were saying that I'm lactose intolerant, I don't like drinking milk, or drinking milk makes me uncomfortable. Lactose is the main carbohydrate in milk. Lactose is an enzyme present in the body that is needed to digest lactose. It can cause, when lactose malabsorption gives rise to symptoms like diarrhea, a little bit uncomfortable stomach ache or nausea or bloating. After the ingestion of lactose or lactose-containing food substance, then it's called lactose intolerance. So what are the dairy value-added products? We not only drinking milk, but there could be also potential dairy milk, dairy products. So technological developments have increased the variety of dairy products in many countries. So the consumers, if they are milk or lactose intolerant, and if they're uncomfortable drinking milk, they could be also consider consuming like yogurt or processed, or so this is which is helps them to still consume milk products, like fermented dairy products, which can be better tolerated by lactose intolerant people. So even if the people who are reluctant to drink milk, they can choose different processed dairy products. And specific bacteria present particularly in fermented dairy products have been associated with immune enhancing and cholesterol lowering properties. So, but still there is a lack of clear evidence, so there is still the research is continue and more research is needed. So we talk about yogurt and other processed or fermented products, but also some milk products are increasingly now some countries are fortifying by adding additional vitamins, minerals, or essential fatty acids, of course according to the specific needs. Particularly, many countries are introducing fortifying milk with vitamin D. So modern health claims of some dairy products should be interpreted with care still, since may have strong scientific support or can also be misleading. So low-fat dairy products can be very high in sugar content, for example, or no added sugar products. Specific component-related claims like bioactive peptides. So then there's a recommendation for the milk and dairy consumption. No, it varies by country. It's not specific standardized recommendation that you should drink at least 1 cup or 2 glasses of milk. But there are some countries have recommendation, like as you can see from here that Thailand is recommended from 1 to 2 glasses per day. India, for example, they promote milk and milk products. Japan, so you can see the different recommendations. They're not standardized. But at the same time, when we talk about milk and dairy products and promoting it, particularly like in the schools or promoting child consumption, we also should consider the safety. The ensuring the safety of milk and dairy products is, of course, essential for consumer health, particularly for the vulnerable consumers, young kids. The quality of milk can be affected by different microorganism contamination, chemical additives, environmental pollution, and therefore it also can degrade the nutrient contents. Milk is very rich in nutrients and provides an ideal growth environment for many microorganisms. So therefore, raw, poorly processed or poorly handled milk can lead to cases of foodborne illness in humans. So therefore, the food safety plays an important role. So I will just skip the slides, and maybe not really. So particularly we want to highlight here, for example, especially the point 2, the aspects related to food safety. A comprehensive risk-based prevention approach is required from farm level, starting from animal feed, milking, storages, transportation, processing, marketing, until it reaches the consumer and at the consumption level. So what are the current issues concerning milk production? Rapid increase in consumption and production of animal products worldwide. You know, now more and more people are urbanized, urbanization taking place, population growth, more and more middle income. Many countries have more and more middle income people. So expanded livestock production causes higher demand for feed. It also provides greater pressure on land and also on the water resources, which is also increased impact on climate change through higher greenhouse emissions, higher risk of disease spreading between livestock and humans caused by more intensive production system and concentration of animals. And then, of course, there are also social implications caused by potential marginalization of smallholders. So how can dairy industry programs could contribute to the development? In many developing countries, nearly 1 billion people live in dairy farms. Small holdings or in landless households, they still keep 1 or 2 animals. So dairy industry programs can contribute to increased household food security, but also improving nutritional status. They could contribute to the rural livelihoods improvement by generating income, creating employment along the dairy value chain. And it particularly can benefit women and young people from rural areas. Particularly women are engaged quite a lot in dairy farm. And there are also increased opportunities as market demand follows rising incomes, more middle income, and especially in emerging Asian economies. A future program should monitor nutrition agroecological impact using clear performance indicators. So how can links between dairy development and nutrition be enhanced? So multi-sector coordinated approach is needed. It's not only a government's task or farmers, it's also private sector's involvement, but also there are development agencies who can provide its expertise, but also researchers, academics. So it's needs of multi-sectoral, but also multi-stakeholder coordination. At the same time, it needs a political support, a high political commitment with a strong nutrition, enhancing promotion and also increase the effectiveness of nutrition-sensitive dairy industry development. And there is also need more campaigning for healthy diet to put milk and dairy products within reach of low-income populations. So in concluding, we would like to provide few findings. These are coming from the publication which we informed you earlier. So milk and dairy products can play a vital role in human nutrition. It's because, as explained, it's source of good protein, it contains different nutrients, especially for the poor people who frequently lack of the diversity or lack of consumption of animal source food. And growing consumption of dairy and other livestock products is bringing important nutritional benefits to large segment of the population of developing countries. So many millions of people in developing countries still are not able to afford better quality diets because to owing the cost, it's more expensive. So, though we said that milk and dairy products are important, but still no single food can supply all essential nutrients. So what FAO try to promote is balanced diet, balance of variety and so on in human and to healthy eating. So the milk and dairy programs, it has a great potential. It has a very important role to play. It's not only as to improve human nutrition, but it's also women empowerment in many countries. And as we say that still in the world we have 842 million who are chronically undernourished, and further 1.4 billion people actually eating having unbalanced diet, causing the overweight and obesity. So agriculture, and particularly dairy, milk and dairy promoting programs, it should go hand in hand with nutrition. And as you know that by UN Secretary General, there is a Zero Hunger Challenge being launched. And so within that also the milk and dairy program could fit very well. And here are some links that you may wish to take note, where the publication can be downloaded. There are some more information and stories we have also in the website. And we would be happy to respond to any questions afterwards. Thank you very much.